Welcome to 3 Secrets to Avoiding Breast Cancer. I'm Dr. Edward Conley, Assistant Clinical Professor of Medicine at Michigan State University and best-selling author of Safe Estrogen, 20 Secrets to Reducing Your Breast Cancer Risk. And I'm here for the American Breast Cancer Prevention Foundation to share with you 3 easy secrets you can use to lower your risk of breast cancer and hopefully avoid having breast cancer ever enter your life. October is Breast Cancer Awareness Month, and we all support the various agencies and nonprofits who are working very hard to try and find a cure for breast cancer. But the American Breast Cancer Prevention Foundation's goal is to supply women with the information that you need to lower your risk of breast cancer, because the very best treatment for breast cancer is to never get it in the first place. So let's start with 3 important steps that you can take to significantly lower your risk that breast cancer will enter your life. Number 1, you must know your EMI score. What is EMI? EMI stands for Estrogen Metabolism Index. And the better your EMI score, the lower your risk of breast cancer significantly. EMI measures how well or how poorly you detoxify estrogen within the body. And you send estrogen in the liver down 2 main pathways. One is called the 2 pathway. The other is called the 16 pathway. The more estrogen you send down that 16 pathway, the lower your EMI score, the higher your breast cancer risk. Shifting your metabolism to that 4 avenue, the 4 path, or the 2 path, significantly raises your EMI and lowers your breast cancer risk. There are foods and supplements available that actually help you to shift your EMI score down that 2 pathway, raising the EMI and significantly lowering your breast cancer risk. And for much greater details, please see the book Safe Estrogen, 20 Secrets to Reducing Your Breast Cancer Risk, where I discuss at length exactly how this happens, and we talk about some of the foods or supplements that can be used to improve that pathway. Lastly, you should know that you actually can measure your EMI score by a simple urine test. But most doctors do not know that this urine test is available. They don't know anything about the EMI. They don't know how to shift your pathway towards the safer 2 metabolite. So please read that chapter on EMI in Safe Estrogen so that you can learn, number 1, how to get the EMI test done, and if your EMI score is low, steps you can take to improve your EMI by improving your detoxification of estrogen. Step number 2, you must know your EQ. No, not IQ, EQ, estrogen quotient. That is, again, a urine test that tells us the ratios of estrogens in your body. You make 3 main estrogen. Estrogen is not one hormone. You make several estrogens. Some of them safer, some of them stronger. And what the estrogen quotient does is measure the ratio of the safer estrogens, called estriol, to the stronger estrogens, called estradiol and estrone. The better your estrogen quotient, the lower your risk of breast cancer. And again, there are steps that you can take particularly if your estrogen quotient is low. So please see the chapter on estrogen quotient in Safe Estrogen, where I describe in detail how estrogen metabolism works, how you make your estrogens in the first place, what raises the good, quote-unquote, estrogen, estriol, and how you can improve your estrogen quotient. It's not that complex, but this is not a measurement that most doctors know about, nor do. And my bet is none of you listening know what your EMI score is or your EQ score is. Lastly, step number 3 is perhaps the most simple, and that is knowing your B12, vitamin B12, and folate levels. The better your B12 and folate levels, the lower your breast cancer risk. Why? Because folate is very important in repairing your breast cancer genes, prevention genes. And therefore, if you are low in folate or B12, which helps folate out, you cannot repair the damage to your DNA in your breast cancer prevention genes. And if you can't repair the damage, those become damaged and reduce their function or become poorly functional. You do not want bad functioning DNA repair genes in your breasts. So this is a simple step. By knowing what your B12 and folate levels are, and which can be done by a blood test through your doctor, we have more sophisticated tests that are done that tells us your active metabolites, how they are doing. But for this step, you can do it through your blood and make sure your levels are high normal. Low normal, or even a middle of the range normal, we are not as good as being high normal. B12 and folate are very safe supplements. Therefore, get those levels completed. Check with your doctor, but if there are no reasons that you should not take B12 or folate, supplementation is cheap and easy. And remember, most of us over age 40 do not produce the stomach acid we used to, and therefore we have trouble absorbing B12 from our food. You may need B12 under the tongue. Those are 3 simple but very important steps to reducing your breast cancer risk. If you know your EMI, and you have your EMI up to normal levels, you know your EQ score, and you make some adjustments in that, and you keep your B12 and folate levels up, you are off to a very good start in helping to prevent breast cancer from entering your life. These are just 3 of the steps that I talk about in Safe Estrogen. 20 steps or 20 secrets to reducing your breast cancer risk. It is important that you read this book. This month in October, I am donating all the profits from this book. Any sales that happen in October, I am donating to the American Breast Cancer Prevention Foundation. So get this book, read about the EMI, the estrogen quotient, folate and B12, and the other 17 powerful secrets that can lower your breast cancer risk, and we're talking about significantly. The other name for this book is Safe Estrogen, Reduce Your Breast Cancer Risk by Up to 90%. But even if you reduce it by 20% or 50%, you have taken great steps to helping to prevent breast cancer from entering your life. So get this book in October, read it, and then give it to a woman that you care about, a family member, a loved one, a friend. How do you get the book? You can get it many different ways. You can order it this month on Amazon.com or BarnesandNoble.com. We will monitor sales, and if the sales happen in October, we will donate profits to ABCPF. You can also order it directly at Bookmasters, which is 1-800-247-6553. And these links should be at the bottom of this video. That's 1-800-247-6553. Ask them for Safe Estrogen by Dr. Edward Conley, C-O-N-L-E-Y. Other steps that you can take to buy the book would be going to bookmasters.com, which is the publisher, and you will see a link to Bookmasters at the bottom of this video. Lastly, please go to the American Breast Cancer Prevention Foundation's website, which is preventmybreastcancer.org. One word. That should be listed at the bottom of this video. There's more information there on how you can support ABCPF's important mission and where you can donate during October to allow them to give these books and other breast cancer prevention information to low-income women who desperately need this information as well. PreventMyBreastCancer.org. Please support them during this month of October. These are 3 simple steps you can take to dramatically lower the risk that you will get breast cancer. You don't have to just sit there and wait. You, as you will read in Safe Estrogen, there are many steps that you can take. Do not just sit there and wait for breast cancer to happen. This can even be true if you have the breast cancer gene or you have breast cancer in the family. This is probably even more important for you. So go ahead and get Safe Estrogen. All profits in October from any book sales will go to the American Breast Cancer Prevention Foundation. You'll find the links at the bottom of this video. And please read this book, share this video with every woman that you care about, send it to friends, send it to loved ones. Make sure they get this information. It is powerful. For the American Breast Cancer Prevention Foundation, this is Dr. Edward Conley for October 2014, Breast Cancer Awareness Month.